All right, let's dive in. Today, we're going to explore the world of art therapy.
Seems fascinating.
Yeah. Specifically, we'll be looking at its history and practice in the UK, kind of like a behind-the-scenes look. Our guide for this deep dive, excerpts from the book, Art Therapy, Creative Therapies in Practice.
I think it's really interesting to see how art therapy has evolved, from its beginnings in asylums to all its different uses today. And we'll get into the influence of psychoanalysis too, and even how anxiety can block creativity. Should be a good one.
Totally. I've always been kind of curious about the connection between art therapy and occupational therapy. They seem to get mixed up sometimes.
Yeah, they do. Their histories are definitely interwoven. A lot of early art therapists actually worked in occupational therapy departments. So naturally, people saw their work as part of occupational therapy. It's interesting because that close relationship kind of continues even today, but now they're definitely separate fields.
Makes sense. So the book talks about something called moral treatment. It says it was a big turning point in mental health care back in the 18th century.
Yeah.
How did art fit into all that?
Well, moral treatment was a huge shift from how things were done in asylums before. It was all about compassion and treating patients humanely. What's amazing is that art was a major part of rehabilitation. It wasn't just something to keep patients busy. Doctors like Dr. Reel, he was a pioneer of this moral treatment. He believed art could help people regain self-control and lift their spirits. This was groundbreaking. It really set the stage for using art as therapy.
Didn't Dr. Rill even include therapeutic theater in his program? Seems way ahead of his time.
Oh, absolutely. He really understood how powerful creative expression could be for healing. Speaking of influences, the book also talks about Edward Adamson, an artist who worked at Netherton Hospital. He's a key figure in UK art therapy, especially because of his hands-off approach.
Which brings us to, I guess you could say, the big thing, psychoanalysis. The book says that modern art therapy training in the UK really requires a good grasp of psychoanalytic concepts.
Yeah, it does. Psychoanalysis has had a massive impact on art therapy, especially in the UK. But instead of getting lost in all the definitions, maybe we should just look at how these ideas actually work in art therapy.
That sounds good to me.
Okay, so for example, there's this idea of transference. That's when a client's past relationships kind of show up in how they interact with the therapist. And you can actually see this in their artwork. A client might unconsciously recreate, difficult childhood dynamics without even realizing it. And that can offer valuable insights into their struggles in the present.
That's really interesting. I can see how art gives you a unique window into those subconscious patterns. But what about people who have trouble expressing themselves creatively? Can they still benefit from art therapy?
That's where the concept of creative inhibition comes in. There's this great book on not being able to paint by Marion Milner. She explores how anxiety can actually shut down creativity. A skilled art therapist can help clients get past these blocks and understand, what's causing them.
So even if you can't create art, that can be a starting point.
Exactly. Every mark, every choice, even avoiding making art.
Hmm.
It all tells us something about the client's inner world.
That leads us to a big question, I think. Symbolism and interpretation.
Yeah.
How do therapists do that without, imposing their own ideas?
It's a delicate balance, for sure. The book really stresses that interpretation should always be collaborative. The client's own understanding of their art is the most important thing. For instance, say a client draws a storm cloud. Instead of jumping to the conclusion that it represents anger, the therapist might ask, what does this storm cloud remind you of, or how does it make you feel? The meaning comes from the client's own experience, not from some dictionary of symbols.
Gotcha. So it's less about figuring out secret codes and more about helping the client understand their own emotions.
Exactly. Art becomes a shared language, a way for the client and therapist to connect. And you know what? Sometimes the process of making the art is just as important as the final product.
Makes sense. Especially for people who struggle with putting their feelings into words. It's like the art gives their emotions a physical form. But how does this all work in a real session? Any examples?
Sure. The book mentions a client named Ben who was struggling with depression. He had a hard time talking about his feelings.
So perfect for art therapy.
Right. He drew a clipper ship. He said it represented his desire for freedom, for things to be easy. But the therapist noticed the ship was actually in rough waters, which kind of mirrored Ben's internal struggles.
Wow. Even simple images can have so much depth. Did exploring this image help Ben?
As they talked more, Ben started to see how his need for control and his perfectionism were causing him a lot of stress. That image of the ship, it was like a visual representation of what was going on inside him. It helped him understand his emotions in a new way.
This deep dive is really showing how powerful art can be for self-expression, for understanding, for healing. And we've only just scratched the surface, haven't we?
We have. We haven't even touched on group therapy or all the ethical considerations involved.
Back again, diving deeper into art therapy. Before, we were talking about how a simple image, like Ben's clipper ship, could reveal so much.
Right. And it's important to remember that in art therapy, the focus isn't always on the final product. Sometimes just the act of creating is therapeutic too.
So you don't always have to analyze symbols and hidden meanings.
Not always. Sometimes it's more about that physical action, making marks, playing with colors. That can be incredibly therapeutic on its own. It gives people a way to connect with their emotions, but without words.
I can see that. Like you're giving your feelings a shape. We talked before about the relationship between the client and the therapist being so important. How does that work when the focus is more on just creating?
Well, the therapist's job is to make that space feel safe, a safe space for the client to explore, and to watch how they interact with the materials. What colors are they drawn to? Are their strokes bold or hesitant? Those observations can tell you a lot about how the client is feeling, even if you don't analyze the finished art.
So the art is like a way for them to communicate to understand each other better.
Exactly. The therapist might point things out or ask questions to get the client thinking, but it's really about empowering the client to have their own aha moments.
You mentioned ethical considerations before.
Yeah.
Seems like boundaries must be tricky in art therapy because it's so personal.
Oh, yeah, you're right. Art therapists are seeing really sensitive stuff, often expressed through the client's art. So they have to be super aware of their own biases. They can't project their own stuff onto the client. That's a big ethical no-no.
It's a huge responsibility. How do art therapists handle that? I mean, it must be easy to get pulled in emotionally.
It is. That's why self-reflection is so important. And supervision, getting guidance from more experienced therapists, that helps prevent burnout too. A strong ethical framework is essential. The book talks about things like clear contracts with clients, making sure they understand everything, and of course, keeping things confidential.
I guess finding the right art therapist is super important then. Someone you trust, who's experienced, but also makes you feel safe.
Couldn't agree more. That relationship is at the heart of it all. Speaking of training, it's interesting how the requirements have changed over time. Shows how much more recognized art therapy is as a profession now.
The book mentions that early art therapists often learned on the job. A lot of them came from art education or like fine arts backgrounds.
Right. Their passion for art was what drove them. But as the field grew, they realized they needed more formal training. Now, in the UK, all training programs have to be validated by, official institutions.
Makes sense. So what's included in modern art therapy training? What are the basics?
Well, obviously you need the art-making skills, but just as important is a strong understanding of psychotherapeutic concepts, stuff like transference, countertransference, defense mechanisms, and of course the whole therapist-client relationship thing. That's a big one.
So it's a mix of art and psychology.
Absolutely. And it's not just theory. Supervised clinical practice is a huge part of training. You got to get that hands-on experience working with real clients in different settings. That's where you really put all that knowledge to work.
The book mentions some of the ethical and professional dilemmas art therapists face. That must be tough.
It can be. Confidentiality is a big one. Art therapists are dealing with clients who are sharing incredibly personal things through their art. So knowing how to handle that information responsibly, balancing privacy with legal and ethical stuff, it can be tricky, like walking a tightrope.
What if a client's artwork shows they might hurt themselves or someone else? That's got to be a tough call.
It is. Those are the situations where an art therapist's ethical training is really put to the test. Sometimes they have to break confidentiality if someone's safety is at risk. It's a judgment call.
Art therapy sounds really demanding. Emotionally and ethically, I mean.
It can be, yeah. That's why having support is so crucial. Having other therapists to talk to, process things with, helps with burnout too. And there are different approaches to art therapy as well. It's not one size fits all.
I was wondering about that.
The book talks about directive and non-directive approaches. With a directive approach, the therapist might suggest specific themes to work with, or certain materials, techniques. That can be good for people who feel stuck, or overwhelmed by too much freedom.
Kind of gives them some structure.
Exactly. It can be helpful if you're working towards a specific goal. Like if someone is struggling with anger, the therapist might suggest using clay to get those feelings out in a safe way.
And what about non-directive?
Non-directive is more hands-off. The therapist is there to support, but they let the client lead the way, explore their inner world through art. No dictating or interpreting.
It's more about trusting the client to figure things out on their own.
Yeah, precisely. The focus is on self-discovery, on believing that the client has the power to heal themselves through creativity. Which approach works best depends on the person, their needs, and the therapist's style.
The book also says art therapy can be used for assessment, which I never thought about.
That's an interesting side of it. While therapy is the main thing, art can also be a really useful tool to understand a client better. You can get insights into their cognitive abilities, their emotional state, even their personality.
So it's not just about expressing yourself, it's also about getting a better picture of how the client functions overall.
Exactly. Like a therapist might use projective drawing techniques. That's where they ask the client to draw specific things, like a house, a tree, a person, how they approach the task, what details they include, the feeling of the drawing. It can reveal a lot.
Sounds like a gentler way to get information, especially for people who don't do well with traditional assessments.
It can be. It lets people communicate without words. That can be really helpful for those who struggle with expressing themselves verbally or who just don't want to talk directly about their problems.
But I bet there's some debate about art therapy assessment, right? Seems kind of subjective.
There has been. Some people question how reliable and valid it is. They say that interpreting art is too subjective, that the therapist's own biases can creep in.
That's a good point. So how do art therapists deal with that?
It all comes down to using tools that are well-researched, standardized tools that are right for the client's age and development. And it's important to remember that art therapy assessment is just one piece of the puzzle. You have to look at it alongside the client's history, what they're struggling with, their whole situation.
It's about using art as a way to get information, but not taking it out of context.
Exactly. Art therapy is this amazing blend of art and science. And it's always evolving as new research comes out and therapists come up with new techniques.
This deep dive has really opened my eyes to how complex and powerful art therapy is. I'm curious about how it's practiced in other cultures.
And that's what we'll look at next. We'll explore art therapy around the world and see how it's been shaped by different cultures.
All right, so we're back, and now we're going to take art therapy global. I'm really curious how it's practiced in different cultures, like how do those differences affect things?
Yeah, it's super interesting to see how art therapy has kind of adapted around the world. You have to consider things like how societies view mental health, or even how easy it is to get art supplies. That can play a role, too.
Really? So even just having access to materials can change how art therapy works in different places?
Oh, absolutely. And think about it. In some cultures, it's just not okay to talk about your feelings openly, but in others, it's totally normal. That's going to affect how people respond to art therapy, right? And how the community sees it.
That's a great point. Okay, so let's start with Europe. The book says art therapy is pretty big there, but with some, well, variations, I guess.
Right. We already talked about the UK, how psychoanalysis is a big influence there. But other European countries, they favor different approaches. Like Germany has a strong psychodynamic tradition focusing on like the push and pull between our conscious and unconscious minds. That definitely shapes how they do art therapy.
It sounds like the theory behind art therapy can be pretty diverse, even within Europe. What about the actual practice? Is it different in different countries?
Oh, yeah, for sure. Things like how integrated it is into the healthcare system, funding, insurance coverage. Even if art therapists are officially recognized as professionals, that stuff varies a lot across Europe, and it makes a huge difference in how accessible art therapy is.
It's almost like art therapy is finding its own way in each country, responding to the specific needs and culture there.
That's a perfect way to put it. It's what makes exploring global art therapy so fascinating. Okay, let's hop across the pond now. How do you think art therapy in the U.S. compares to what we've been talking about in the U.K.?
Well, I know the U.S. really emphasizes research, evidence-based practice in healthcare. I wonder if that impacts art therapy too.
You nailed it. Art therapy training in the U.S. often puts more emphasis on assessment, like diagnosing conditions. And they're big on scientific research, proving that it works.
It seems like art therapy is more, official in the U.S. They have licensing requirements and professional organizations setting standards and all that.
Yep, exactly. Professionalism and accountability are big in the U.S. approach.
Okay, let's travel a bit further now. What about Canada and Australia? How do they do art therapy?
Canada's got a really lively art therapy scene. Places like the Toronto Art Therapy Institute have been super influential. A key figure in Canadian art therapy is this guy, Dr. Fisher. He developed a whole approach focused on spontaneous art making, as a way to tap into the unconscious.
That sounds kind of similar to the idea that the process of creating is therapeutic, which we talked about before. But I think you said there's been some criticism of his approach too, right?
Yeah, some people say Dr. Fisher's method focuses a little too much on interpretation. Like, maybe it doesn't give enough weight to the client's own understanding of their art. Which brings up that tricky balance again between guiding the client and letting them discover things for themselves.
Finding that balance sounds like an ongoing challenge in art therapy, no matter where you are. Okay, what about Australia? I think the book said art therapy's had a tougher time there.
Yeah, that's true. Australia tends to have a more medical approach to mental health. So traditionally, they've favored things like medication and, more talk-based therapy. Art therapy has had to fight harder to get recognized within that system.
So it's had to prove itself, basically, show that
Yeah.
it's just as valuable as those other approaches.
Yep, exactly. But despite the challenges, art therapy is definitely gaining ground in Australia. Now they've got dedicated training programs, professional organizations, and more practitioners are working in all kinds of settings.
It's pretty inspiring to see art therapy making progress around the world. Adapting to different cultures, but holding on to its core values.
It really shows you how universal art is. It's a powerful tool for healing, for expressing yourself. No matter where you live, creating art can help you connect with yourself and understand your experiences.
This deep dive has been amazing. We've gone through so much, the history, the theory, what it actually looks like in practice, both here in the UK and globally. It's just incredible how art can transform people's
It
lives.
truly is a remarkable field. And for anyone listening who's feeling curious, remember, you don't have to be an artist to get something out of this. The magic really happens in that creative process.
Love that. So whether you're painting, drawing, sculpting, or even just doodling, give it a try. Tap into that creative energy. You might be surprised by what you find.
Maybe you'll discover a hidden talent, a new way of seeing things, or even just a little peace and quiet with yourself. It's all there, waiting to be explored.
And on that note, this wraps up our deep dive into the world of art therapy. Thanks for joining us, and until next time, keep exploring, keep learning, and keep creating.